privilege to be here today to talk to everyone about one of the topics I find most exciting, which is theories of IQ and what IQ is, what it isn't, and also sort of understanding the developmental trajectories of IQ over time. Thank you to Dr. Smile for providing a land acknowledgement, and I want to do my own. So again, we're gathered here today on the traditional ancestral and unceded territory of the Coast Salish peoples, including the Musqueam, Squamish, and Tsleil-Waututh nations. So here's what I semi-promised to be able to do today. First is to define the construct of IQ and what sort of its theoretical underpinnings are and what the history of it is. And spoiler, it's not a great history. So it's a bit of a dark chapter for psychologists in our legacy, and kind of applying that knowledge to how we do developmental assessment today. We will also look at the current research on the longitudinal stability of IQ scores in both neurotypical and neurodiverse pediatric populations, and using that information to help guide sort of some guidelines for us about referral criteria and appropriate timing for IQ testing as it relates to different diagnoses in pediatric populations. And because there's so much heterogeneity across different clinical populations, I'm kind of going to focus on what I know best, which is autism. And you can kind of consider that as like a sort of a broad case study in terms of how IQ can look different in clinical populations. Okay, I want to give a special thanks to Dr. Smile for asking me to come present today, and to the Sunny Hill Psychology team for helping to provide some of the background and support, and also special mention to the Sunny Hill SLP team who are here in their full contingent today. So what is IQ? It seems like a really simple question, and we kind of equate IQ to intelligence, and IQ does stand for intelligence quotient, or a number we can give to someone's quote intelligence. It is really at its basic level a standardized score derived from standardized cognitive assessment. That's nothing new. That's kind of how we understand it. When I'm explaining it to families, I'm explaining it as sort of like an umbrella. So IQ is kind of like the umbrella, and then there's the different abilities that underlie that. So like verbal and nonverbal reasoning, visual spatial skills, working memory, et cetera. And that conception of IQ as kind of the umbrella has developed over time. And I'll talk about in a minute what that history looks like. But modern kind of theories do see kind of an overarching overall kind of IQ or kind of intelligence factor that kind of accounts for the most proportion of variance. But then we do have those specific skills underneath it that are also meaningful in their own way. And as we know, common tests, the Wechsler scales, developmental abilities or differential ability scales, Stanford-Binet, we have quite a few. As we know, an IQ score is derived from comparing to a normative sample of age-matched peers. The mean is 100, the standard deviation is 15. So this seems pretty straightforward, and we use these tests every single day to help inform our decisions. But the question that we ask is, does IQ actually measure intelligence? What does it actually measure? And we kind of assume that it does. Intelligence quotient, we would assume that that measures intelligence, but it's actually a bit more of a complex question. And the applications of that are important for the populations that we see, because these tests don't necessarily measure the full contingent of what we can consider intelligence. So to understand that, we have to go a little bit back in history. So if you'll indulge me a bit, I got to go back to my grad school days and all of the hours of testing and studying I spent learning about the history of IQ. I had a really good professor once who said, to understand where we are, we have to understand where we came from. So it's important to look back a little bit. So the early views of intelligence were best understood at that time as a single construct that was fixed, so could not be changed and solely inherited. So you got you were just born with this level of intelligence and there's no change that can happen. And these are some of the names of some of the first people to sort of systematically study individual differences in attention. It was, of course, more rudimentary back then. The earliest studies were based on like reaction time and equating that to intelligence. It's developed over time. I've highlighted the name Galton here. If you already kind of have an idea of who that is, good. If not, just remember that name when we get to the next part. So that's our understanding. The very early days, intelligence was thought of just this fixed construct that you have, and it can't be changed over time. This strapping gentleman is Alfred Binet, a French psychologist, and he created the very first standardized intelligence test. It was called the Binet-Simon scale. It was developed in 1905. It was developed for really good reasons. So they took the work of those earlier people and they said, how can we apply that to help students and identify who needs more help? So it was fairly noble sort of intentions for doing that. He was also the first person to kind of coin the idea of mental age. So what we kind of think of now as developmental age relative to chronological age. And he actually rejected that idea of fixed intelligence, that it was like one single thing that you have, that you inherit, and then does not change. So he was inspired by that early work, but adapted it and kind of moved it forward. And so he didn't, again, believe that intelligence was a single thing, but it was more complex and it was a pattern of things that made up intelligence. And he also believed it could be developed, which kind of makes sense based on how he wanted to use the test. He also says it shouldn't be forgotten that our purpose is not to measure that which is invariable and innate, but rather to measure the degree of development attained at that moment by the child. So his intentions were to use it to help develop support and develop their learning over time. So what happened? Well, those intelligence tests were then brought to North America. And the person who translated the test, that Binet-Simon test, was a man named Goddard. He translated it to English. He made no other adjustments. So there was no like standardization. There was no comparison to a North American sample. It was just straight translation of that test into English. Now, he was inspired by Sir Francis Galton, who was the originator of the eugenics movement. And so this test, these ideas of intelligence at that time were used for really unfortunate purposes. So they were used to sort of restrict immigration. These tests were used at Ellis Island to help determine who got to come into America and who didn't, for really classifying students in a very biased way in terms of educational tracking and putting students into, specialized classrooms or not allowing them into general education classrooms, who should be institutionalized, and really was kind of formed a scientific, quote, scientific argument for the eugenics movement. So this was only like 100 years ago in the grand scheme of things. And so as psychologists, this is where we're coming from in terms of knowing that this is the history of these measurements, these tools that we use every day. The Binet-Simon was translated into, well, it was actually standardized. So this person kind of just translated the scale. It was then standardized by a professor at Stanford and became what's known as the Stanford Binet, which is now on its 5th edition that we use now, that I used within the last month. And so it really wasn't that long ago. And so that's the history that we're coming from. And this is kind of what I think of when I kind of laugh and say psychologists are very cautious people, and we're very, we don't tend to make decisions quickly, and we tend to maybe overanalyze it. And I wonder if part of it, at least for me, is remembering like this is the history we came from, where these tests were significantly misused. So the evolution, there was, of course, reforms, right, that happened over time. People became more aware of the cultural and linguistic and socioeconomic bias of IQ testing. And there were some landmark court cases in the 70s and 80s that sort of highlighted that continued racial bias. And so students of color were disproportionately sort of tracked into special education classrooms. And there was, in my research, I learned something new, there's this social worker who was a huge advocate for adding adaptive behavior into the diagnostic criteria. And she in her lectures would describe, I won't use her original language because it's outdated, but sort of a 6-hour intellectually disabled student, where at school, they were intellectually disabled, and then they would leave school and like go pick up their brother and get the shopping list and, you know, plan and do all the things they needed to do. And so it kind of highlighted, like, you can't just be intellectually disabled at school. What is that saying? That's saying that whatever was used to make that decision was biased. So adaptive functioning was added as a criteria to intellectual disability to the DSM, but only in 1980, which was really not that long ago. And it kind of has highlighted this need for a multi-component assessment. We cannot just rely on these scores. And we also can't just rely on adaptive functioning, but it's another sort of data point because it's so complex. And also, as I kind of alluded to at the beginning, we've had a shift towards viewing intelligence as sort of more malleable and not necessarily this fixed construct that you just are in kind of inherit, and there's no change to it. So even the authors of the tests that we use widely acknowledge that these tests have limitations and that the test themselves does not necessarily equal intelligence. And so it's a little bit of circular reasoning, because it's like, well, the intelligence tests what the intelligence test tests, basically, right? Does it really test all of intelligence? So David Wexler is famously the developer of the Wexler scales, the WISC, the WACE, the WIPSI, those things that we use every day. And here's what he said back in 1939. The kind of life one lives is itself a pretty good test of a person's intelligence. When life history is in disagreement with the psychometric, so the score, it is well to pause before attempting a classification on the basis of tests alone. Generally, it will be found that the former is a more reliable criterion of the individual's intelligence. Kaufman, who has his own test, the Kaufman Assessment Battery for Children, but also is the ghostwriter for the WISC now, because David Wexler has passed away. He says IQ tests measure only a fraction of what can legitimately be thought of as intelligent behavior. And Wexler again saying the term intelligence quotient is a misnomer. The scores derived from intelligence tests are not measures of intelligence, but only of performance on the tests. So it kind of sounds like I'm talking myself out of a job, right? In terms of like, why do we use these things then? Well, I promise that they do have some value. So what do they measure? IQ tests don't measure, as I'm alluding to, some like mysterious underlying like intelligence that we can somehow access in this 90 minutes that we spend with a child. But they measure how well a person performs on a particular set of cognitive tasks at a given point of time under specific circumstances. It doesn't measure creativity, motivation, social emotional skills, potential for growth. It's very much influenced by the environment, the opportunity that the person has, and test familiarity. I just tested a kid recently who's never been to school, and they're 10 years old, and I had to give these tests to him. He's never had any situation where he's had to sit and do these things. He has no familiarity. So that's going to affect his scores. And of course, they still remain susceptible to bias. We know that some tests have more cultural and linguistic loading than others. We use that info to help us make decisions about what to do with certain kids, but they remain very much susceptible to bias. And that's something that we work with every day. So why does it still matter? And I promise it does, but I am biased. IQ tests still provide sort of useful objective data. So when we use them responsibly, when we interpret them in context, they provide a standardized information that's comparable across people that allows us to kind of compare different profiles and also give a common language and understanding among professionals. It also supports equity in eligibility decision-making, whether or not, the cut scores or whatever to get into a particular program we agree with. It does support kind of that equity in terms of there's a standardized number that we give across everybody that will kind of help support that decision-making. Diagnostic clarity as well, right? So we're trying to determine, are they having difficulties learning to read because they have a specific learning disorder, or is it a more global impairment? Similarly with autism, are their social skills kind of more delayed relative to their developmental age, or is it a more global impairment? It also can help us understand at the more granular level their cognitive strengths and weaknesses. So it can kind of guide intervention planning in terms of memory skills, processing speed, verbal versus nonverbal skills, and helps us to monitor development and outcomes. So we're thinking of things like medical conditions, traumatic brain injuries, effects of like chemotherapy on the brain, developing brain. We need this kind of data to be able to track over time. All right, so we've sort of established that IQ has a dark history, but that we have learned and we continue to evolve. We've established it can't possibly measure everything that is intelligence, but it does have a valuable sort of place in our world. So how stable is IQ over time? And this is a question I get a lot from families and from other professionals, is like, well, okay, this is what their scores are now. If you tested them again in 5 years, can they improve, right? If they have ID now, can they improve and not have ID, right, in 5 years? Or what will their scores look like? So the stability of IQ scores is a very necessary condition. We have to assume that they're stable, otherwise they would have very little value for this purpose. So if we want to use them reliably and use them to track across time, we have to expect some level of stability. There's not a lot of, there's sort of some longitudinal studies, but there's a lot of heterogeneity in terms of, the measure of IQ testing that they use and the outcomes, the ages. But lucky for us, there was a meta-analysis done in 2024, which is really good timing for my presentation today. So this encompassed, it was a very large data set, and they had exclusion criteria, and they ended up with 205 studies from 1921 to 2020. So it's quite a range, ages 1 to 88, and in total around 87,000 participants. So it was quite a broad study. They also included a range of IQ tests, but they have very specific sort of criteria for how they're matching those. And the primary measure, and this is important, is rank order stability. So it's different from what we might think of as like, if I took a test today and I took a test in 5 years, would my scores fluctuate? Rank order stability is more, does your rank order relative to other people stay the same? So you're kind of in a similar position relative to other people, and everyone's scores might shift a little bit, but we're kind of expecting that to be reasonably uniform, such that your sort of placement is reasonably the same. So what this meta-analysis found is that generally intelligence, that IQ scores are stable across the lifetime, and fairly strongly. So the correlation coefficient around 0.65 to 0.8. What they found was a substantial age effect, such that stability increases pretty steadily from early childhood, and then it kind of is like an asymptotic relationship. It kind of reaches an optimal level of stability around age 18, and then there's no real further meaningful increases in stability. But in early childhood, scores are basically no stability in those scores over time. It's very low, and it rapidly increases into middle childhood. It's about at 0.7 by age 8, and continues to increase, as I said, until around age 18. So individual rankings, that rank order stability, can shift quite a lot before the age of 8. The other effect they found was the time interval. So test, retest, time interval, how much time in between. As we would expect, stability declines as the gap increases. So shorter test, retest had higher stability. So like a 2-year versus a 10-year, but it again sort of levels off. So there comes a point where stability doesn't, increase or decrease anymore. It's not like an unlimited thing that continues to decay. So what are some guidelines for this? And this scares me a little, but I have another slide that will help contextualize it. So this is some guidelines that they gave in terms of how we understand stability and whether or not a retest would provide any further information at a particular interval. So when they applied very, very strict criteria, so a correlation 0.8 or above, which is very strong, below age 8, that criteria is not met. So a reassessment between like 5 years and 7 years old is not going to be particularly stable. Between 8 and 12 years old, they assume that high level of stability for around 2 years. Between 12 and 18-year-old, they assume that for about 4 years, and 18 and above, that's assumed for about 6 years. The reason this scares me is because this doesn't mean that all kids need to be reassessed within those timeframes. It doesn't mean that they're even needed or warranted. What it means is meaningful differences in rank order stability are unlikely to be observed in those time intervals. But it's important to remember, again, across all test-retest intervals, across the lifespan, the average stability is still strong. So regardless of kind of that test-retest, there's some level of stability that we can reliably expect in terms of rank order. Major changes in cognitive scores, IQ scores, are rare and unexpected. So outside of significant circumstances like traumatic brain injury, serious illness, extreme trauma, neglect, rare occurrences, we would expect large individual differences in intelligence scores. There is some fluctuation in intelligence scores, and that's why we have the confidence interval. So there's a 95% score band around the true score. And psychologists don't really get all that worked up unless the score is outside of the original confidence interval. And especially if it's, more than a standard deviation. And that's when we kind of go, And that's when we're wondering about, is there something neurological going on? Is there something medical going on? Or what's going on? What has caused that? Because we otherwise expect it to be reasonably stable. So why is it so stable? So meta-analytic twin adoption studies, they show that the stability of cognitive abilities is largely due to genetics, especially as people age. I indicate not solely, because this is not a return back to our original conception, which is that intelligence is fixed and solely inheritable. But there's a large genetic influence to the stability, and that starts out quite low. So in early childhood, what they found is there's not a lot of variance accounted for by genetics, but it increases really fast during development and then remains really high from adolescence through adulthood. Shared environmental factors like family, school, things like that, socioeconomic status, also contribute to stability more early in life. So we see that balance shift. It's like environmental factors seem more important in early childhood, become a little less important as they age. But in other words, what this is showing is that we expect intelligence quotient to be relatively stable because it's based in stable factors. It's based in something like genetics, which is a stable factor. So that kind of adds some weight to our claim, right? That no, I would expect the scores to be stable because they're based in fairly stable factors. What did they not find in this meta-analysis? They didn't find any other interaction effects in terms of subgroup differences. So aside from age and test-retest, there was no other interaction effects. So no interaction effect for cognitive ability levels, sometimes thought of as ability differentiation, where high IQ, other studies have found that if you have the higher scores, you're more unstable. It can fluctuate more versus if you start out with quite low scores, that tended to be more stable. But this big meta-analysis didn't find that. They also didn't find any sex differences. They didn't find any geographic differences. So essentially the stability was sort of constant, except these patterns that we found with age. But clinical samples were excluded. So these were reasonably, typically developing people. So that brings us to the next part, which is what does it look like in clinical samples? And I'm using autism as an example here to highlight it. One, because I'm biased towards it and it's what I know the best, but also because it's pretty interesting sort of how it looks and how, as much as autism is so heterogeneous, there's some actually distinct patterns that we see in the trajectory of their intelligence. Don't get too excited. Okay. So what do we know? Well, compared to those neurotypical samples, IQ is less stable overall in autistic individuals. And also there's greater profile scatter. So when we're thinking of that, like that rank order correlation, that's your ranking sort of relative to other people over time. When I'm talking about scatter, I'm talking more about those individual scores and profile. So working memory versus processing speed versus visual spatial skills. It tends to be a little bit more dynamic in autistic individuals, and you can see some changes. They're also kind of famous for having kind of asynchronous development and profiles. And so it's not really interpreted in the same way as a neurotypical person. And we know that preschooler IQ is not particularly stable in any child, but it's even more unstable in autistic kids. So what is unique, though, is that that last meta-analysis, there really wasn't any in-group differences. There wasn't a ton of heterogeneity, but in autism, there is in terms of the stability. And studies have sort of demonstrated over time these kind of consistent patterns of subgroups. So what they found generally is you have a group that has sort of persistent intellectual disability, where they have that low IQ that's stable over time. But then what you also have is what they call like a change group or a catch-up group that has large gains in IQ over time. And in fact, the studies found like we're moving from from ID range outside of the ID range, like that much change in scores. And then we have a persistently sort of average or above average IQ. There's a smaller group that shows some decline, but it's not as robust as these other groups that were found. And also what they found is it's mostly related to like a regressive pattern or aggressive phenotype or other factors, but it is possible as well to see a pattern where a smaller subgroup of kids who might have a decline. Of course, what I think is most interesting is these change groups or the catch-up groups who make really large IQ gains. I'm going to show you the most recent study that I found on that. And this was from the UC Davis Mind Institute. They did this study in 2018 with just young children in middle childhood. And then they did it again in 2023, and they extended it to sort of pre-adolescence. So we're able to see a trajectory a bit farther. And again, their patterns were similar. So about 45% of the group had persistent intellectual disability. 39% had marked IQ gains over time. That is a huge number, in my opinion, in terms of how many kids you might see that have very low or low IQ scores. And then if you see them 3, 4, 5 years later, they might not anymore. And that is not a pattern that you see in neurotypical kids. It would be very, very rare. It'd be very unusual. And I would wonder what happened in the testing sessions or what were the contextual factors. But in fact, in autism, it's not rare, right? 39%, at least in this study. And other studies have found, like 15 to 25. So it's a good proportion of kids. The most rapid period of growth, and we looked at the growth, the study looked at the growth curve, and it kind of grows from childhood and then most rapid at around age 8 or 9. And if we think back to our previous study guidelines in terms of that meta-analysis, things become more stable around age 8 for neurotypical kids. So there's some similarity there in terms of when we can expect greater stability. And then a smaller proportion, around 16%, were persistently average or above average. So what is going on with these changers, I think, is the question on everybody's mind. There is less sort of, it's very kind of well established, that pattern, that there are those subgroups and that there are that change group. What's less established is why they have that change. I think logically we think, oh, well, intervention or that must be it. There's some studies that have found that it's because sort of following intervention that they have increased scores. Some kind of relate it more towards, their genetic profile and neurological development that just sort of takes place in that time frame. And others kind of can attribute it to kind of clinical features like they have here, or test session behavior, such that these tests are not designed for kids who, think and process things so differently than neurotypical kids. We're trying to assess things in ways that just don't match with sort of their motivation and their preferred methods to communicate. So there's a lot of reasons that could be behind it. What this study has drawn out statistically is that for for the change group and the persistent sort of high average group, they were distinguished from the ID group by better early adaptive communication. So their score on the communication domain on the Vineland was higher, and they had lower autism symptom severity based on the ADOS severity score. And then what changed in terms of time 1 to time 2, what favored changers was, again, their improvement in adaptive scores, especially in terms of communication, and also decreased in externalizing behaviors. So essentially, the value here is understanding that better, communication, at least as measured by the Vineland in this case, was, seemed to be attributed to that improving trajectory versus the stable low. But that was just one measure. And other studies have found similar, such that, higher baseline language skills are sort of more related to that change over time, and improvement in language is related to improvement in IQ as well. So it's not as established in terms of the reasons behind it, but what is established is that it does exist. So this leads us into sort of how do we use that information? So the timing of referral for IQ testing then kind of becomes especially important. If we had all of the resources in the world, then we would probably test at multiple time points. We would test when they're little and assume that's unstable. We would then test in middle childhood, and we might test in adolescence, but that's not really something that we can do. When I worked at McMaster in the autism program, what's different about that than here is that they took the kids in for treatment there. So they did treatment at the center. And so they tested all of them when they came in, and no one got a diagnosis of intellectual disability. They would wait a year of intervention, and then they test them again. And they track them basically. And so they had multiple data points of IQ. And I would sit in meetings where they would look through it and go, yep, she's had these 2 years. This was her response to intervention. Like, her IQ scores are still low. Like, now we feel we can call it. We're going to call it intellectual disability. And unfortunately, that's just not super feasible in very many places. And it's certainly not feasible here, right? At Sunny Hill, we see them one time, and we're trying to make decisions. So it's tricky, but what is really important, though, is to not overinterpret early low IQ. It's probably true for all kids, but it's especially important for autistic kids. When they get that low IQ score, according to that recent study, 45% of the time it might stay low, and 40% of the time it might improve. And that's why we're kind of, as psychologists, at least myself, so cautious in terms of making that diagnosis. We know, of course, that if you have autism, you also have a higher likelihood of having intellectual disability. So there is sort of that balance there. We don't want to miss anybody, knowing that we might be their only assessment that they get. We don't know when they're going to get assessed again. But it's also, what we don't want is to give a label that is not accurate. And I have, been in situations where I've had kids that were tested when they were 5, when they had just moved to Canada. They did not speak English. They were tested in English. They got a moderate intellectual disability diagnosis at age 5. When I saw them at age 16, and they did not have an intellectual disability, and they had been in special ed their entire life. So obviously that's the exception, not the rule. But what we know to be true is that it's much more likely for an autistic kid to have the potential to improve out of the IQ range than it is for a non-autistic kid. So we need some kind of special attention to that. And if I could choose, I would reassess after they'd had some intervention. And in fact, that's what I write in my reports. That's what most of us write, but we just can't guarantee that that's going to happen. But similar to neurotypical children, sort of major changes in IQ past that middle childhood point around age 8 are similarly rare and unexpected, even in autism. We do see that dynamic profile. What I wouldn't expect necessarily would be someone who had, average or low average IQ to now be in the ID range, unless there was other things going on. So those major changes remain sort of rare and unexpected, even though the profiles are more dynamic, if that makes sense. All right. So what have we learned? IQ is complex. It's not like we thought of in the very early days, a fixed construct. It's heritable. You have it, you can't do anything about it. It's malleable to a degree, right? It is affected by environmental factors. Like everything we know now, it's a little bit of nature and a little bit of nurture, right? And that IQ does not equal intelligence, or at least all of intelligence. It measures a facet of it. We've learned that stability varies by age for everybody, but it also varies based on the neurodevelopmental profile. And using that information, we're kind of needing to consider the timing of when we're assessing them and how much value that can add, and whether the value of that outweighs the potential risk of having them mislabeled and misunderstood. And ongoing attention, of course, to reducing bias and increasing accurate classification. All right. Time for questions.